Good morning, good afternoon, good evening. This is Firoz Manji talking on our show, Organizing in the Time of COVID-19. A warm welcome to you all. Today, I'm going to be talking with an extraordinary woman, Soffiyah Elijah. I'll tell you a little bit more about her in a moment. But just to set the context, she's going to be talking about the effect of incarceration in the US. Today, the United States makes up 5% of the world's population, and yet it has 21% of the world's prisoners. African Americans are incarcerated at more than 5 times the rate of white Americans. Though African Americans and Hispanics make up about a third of the US population, they comprise more than half of all incarcerated people in the current situation. And long before the advent of COVID, of the 1,000 plus jail deaths, an average of 3 a day, reported by the Bureau of Justice Studies in 2016, nearly a third were suicides, while others were homicides, and only half were caused by illnesses, often exacerbated by inadequate medical care. Much of it provided by privatized companies who are providing those services. So today I'm speaking with Soffiyah Elijah. She's the executive director of the Alliance for Families for Justice, whose mission is to support, empower, mobilize families and individuals impacted by the criminal justice system so they can marshal their collective power, which I think is just great, their collective power to create a just world. Elijah, welcome. Soffiyah, welcome so much to the show. It's so great that you were able to spare time. You've been an executive director of the Correctional Association of New York, where you were the first woman and first Black person to lead that 170-year-old organization. It's really impressive background that you have. You are also a lawyer and worked at you were the deputy director of the Criminal Justice Institute at Harvard, were you not? It's really really great to have you on the show. So welcome.
Thank you.
We're focusing our attention today on organizing in the time of incarceration and COVID. And one of the phrases that you've used, Soffiyah, is you talk about prisons as weapons of mass destruction. Can you elaborate on that?
Yes. First, thank you so much, Firoz, for having me here and for focusing on this very important topic. It couldn't be more timely. So the phrase weapons of mass destruction as it pertains to prisons came to me at a time when the U.S. government was accusing countries in the Middle East of possessing weapons of mass destruction, which eventually was found to not be true. And I thought it was very ironic that while the attention of the country was focused across the globe, that we weren't looking at the weapons of mass destruction that we had built right here in this country, where we put millions of people in cages, destroying them, destroying their families, and destroying the communities from which they came. So it seemed to me that the most glaring weapons of mass destruction that we had to focus on were the prisons and jails throughout the United States that were wreaking havoc, particularly on Black and brown communities. And there was no attention or concern being focused on those realities.
weapons of mass destructions at the best of times. But we have a situation now with COVID, with the coronavirus infecting many people, both outside and within the criminal justice system, the prisons, jails, and so on. It seems to me that what is emerging across the world is that while it's quite clear that this virus is lethal, what kills people, unless they have an underlying health problem, is the lack of adequate services being provided to people who when they fall ill, it is treatable. It is imminently treatable. So what is it happening in the prisons, and what's happening in the communities?
First, I'm going to talk a bit about what's happening on the national level, and then I'm going to focus on New York State. One, because that's where New York State and New York City have become the epicenter of the COVID-19 pandemic in this country. So healthcare inside prisons and jails throughout the United States is woefully inadequate. And it has been so probably for as long as prisons and jails have existed in this country. Part of that is because the general public doesn't care about the health and concerns of the people who are incarcerated. They have been viewed as disposable and unimportant, and any form of additional punishment that is visited upon them, the general public doesn't seem to concern itself with. And so inadequate health care has been the reality for anyone who's been incarcerated in this country.
So I think you have frozen. I think we lost you a little there. Sophia, I think we lost your sound.
Okay, let's see. Do you hear me now?
I can hear you now.
Okay.
Okay, you were talking about the national situation and the effect on families.
Yes. So I was saying that healthcare overall is.
Oh dear.
Am I back?
You're back now. I think the NSA is busy trying to stop your voice going out. You know.
Yeah, I was thinking that maybe they don't like what I'm saying. Well, that means I'm going to say more, and I'll say it faster. Okay.
Yeah.
All right. I would say,
so carry on. Your healthcare.
And in many prisons, you'll find that doctors who have had their licenses suspended are the doctors who are working in those facilities. Many times there's understaffing of the healthcare professionals provided in the various facilities. This is on the federal level and on the state level. Now, focusing on New York and the COVID-19 pandemic. Mm-hmm. First of all, there is no comprehensive plan for the care of people who are incarcerated in the state's prisons right now with respect to COVID-19. Every facility is doing its own thing. There have been countless reports about the fact that social distancing is one of the main things that the Center for Disease Control has advised that everyone must adhere to. Governor Cuomo for New York State has issued executive orders demanding that New Yorkers exercise social distancing and stay home. However, in every prison and every jail, that is impossible. The ability to stay 6 feet away from anybody is impossible. Cages are right next to each other. That's in maximum security facilities. And in medium security facilities and minimum, the people are held in dorm-like settings, in double bunk beds and closed environments. So it's not possible to be 6 feet away from anyone, and no one's issued a mask or gloves. In fact, in most facilities, there's no access to hand sanitizer or antimicrobial hand washing liquid. And so it's a petri dish, and that's the language that has been used by many, many experts when talking about the horrific situation that we find ourselves in with respect to prisons and jails, and no comprehensive plan to address the health needs of the people who are in the most vulnerable situation. So you'll find orderlies who are being told that their responsibility is to clean the quarantine unit, and all that's happening is they're being given bleach and told, use the bleach. They're not being told any extra precautions that they should take with respect to how to quarantine and protect the people who are held there. We have situations where staff has been tested and found to be positive for the virus, and instead of testing everyone who's held on the tier or the block where that staff person works, that entire tier is put on lockdown, but no one's being surveyed for symptoms or tested for the virus. So you have a situation where the virus is going to spread like rapid fire throughout the prisons and the jails in New York State, because there's no comprehensive precautions that are being taken to protect that population.
Is this being done on purpose?
You know, we could argue about whether neglect is purposeful or intentional. In some ways, it doesn't matter because the result remains the same. About a month ago, the state suspended all social visits, so family members aren't able to go see their loved ones and to check on their health. That means that people inside, their only way to communicate with the outside world is through letters or phone calls or using tablets. Now, of course, they have to pay for each of those things, and the state has announced that they're going to supplement slightly those services so that people can reach their loved ones. But it's not the same as being able to lay eyes on someone. And since the suspension of visits was implemented, our office has been besieged with reports of increased physical abuse, use of solitary confinement, and even worse, medical neglect. So we have a crisis situation happening in the prisons in New York State.
So one of the things that you are very intimately involved in is supporting both families and communities in organizing. So what's been happening? What's been going on in terms of trying to deal with this situation directly from within the communities?
Well, first I would say the requirement for social distancing has significantly altered how you can organize people. So for instance, our organization has monthly community organizing meetings where people come from all over the greater metropolitan area to meet and discuss issues of concern with respect to incarceration and their loved ones. Obviously, we can't do that now. Many of the people who are impacted by incarceration are poor and don't have the access to the internet and the more recent devices, smartphones, etc., such that they could keep in touch with people and stay on hour-long and 2-hour-long virtual meetings because they have limited data plans. For many of them, they have a paid-for plan that has a limited number of minutes available to them per month, and so they can't sit on a meeting, a virtual meeting for an hour or so. So we've had to alter our methods for reaching out to our family members. Some of it has been by phone, some by email, some by texting, and I'm very, very thankful to our family members who have stepped up and helped us create a network that we call Supportive Voices, where they're reaching out to family members who are impacted all over the state to touch base with them, to see how they're doing, and to gather information about what's happening in real time behind the walls.
Wait, hang on a moment. You're talking about New York? I mean, what you've just described is what some of my colleagues in Kenya have been talking about. The problems of organizing is that nobody has enough cell phone time and data time to be able to organize. And this is New York, you're saying that this is happening?
So let me explain. It's a multifaceted problem. First of all, everyone's been ordered to stay home. So people are working from home, and that is increasing dramatically the strain on available internet service. Okay? The children are staying home, and they're being taught virtually. So they also need access to internet service. Okay? Then people are planning a whole host of conference calls and virtual meetings through Zoom and other online platforms that are also draining the available internet service. So that's one part of the problem. Then the other part of the problem is the majority of the people whose lives are impacted by the criminal injustice system are poor, Black, and brown. And so when they're budgeting, there's meager resources each month. Most people in that situation don't have unlimited data plans where they can dedicate time to sit on a virtual call for an hour or 2 hours. So they have a limited number of minutes, and they're trying to hold those available for when they get calls from loved ones inside and staying in touch with family members. So that means that the ability to access people in that socioeconomic strata is limited through the various problems that I just articulated.
Yeah,
this is New York.
Yeah, this is New York. Yeah, and with people, the families themselves being incarcerated at home, locked up, unable to communicate. What's going on in the homes? We've had a lot of reports of domestic violence and child abuse that is beginning to go on the rise. Is that something that you're witnessing in New York?
I can tell you anecdotally, because our organization is not focused specifically on domestic violence or child abuse, but anecdotally, I've spoken to numerous organizers who are in a state of depression, which is already concerning, but it's even more concerning because the governor's already announced that at least through the end of April, the stay-at-home order is going to remain in place. So people are suffering from cabin fever, and then add to that, New York's, particularly New York City, already faces a housing crisis. So people are living in small quarters, many people in small quarters, forced to stay inside, and just recently the playgrounds were ordered shut down. So there's no place for children to go outside and play. People are being told they have to stay in their homes. You have the children in homes, multiple generations, and if you want to go buy groceries, you have to stand on long lines outside for a number of hours. So the level of frustration and stress for many, many people is increasing with no coping mechanisms for how to address this. Because we have a society that's used to immediate gratification and not using inner strength and the meditation and other forms of staying at peace so that you can handle these kinds of challenges that are presented.
And so, I mean, just thinking about the lives of people, I mean, where do they get their food? How do they get their food?
When you go to a grocery store and you stand on line outside, because only so many people are allowed in a store at any given time because of social distancing again. So, for instance, this past weekend, I stood online to go into the food co-op for 3 hours and 35 minutes before I could get inside.
Wow.
And that was, I thought that, well, that was very, very bad. A week and a half earlier, I'd stood online for an hour and a half, and I thought that was unconscionable. But the 3.5 hours was just beyond the pale.
So what? I mean, it seems it's the same story with everyone I speak to across the world. What what are the opportunities? How creative can we become about organizing? What can be done? What can be done creatively that allows at least expression of social solidarity to prevent? I mean, the worst thing that can happen is people getting depressed, demoralized, and so on. So, what are the opportunities?
So I think actually this situation presents us with a very interesting opportunity. If we look back at how organizing was done before we had access to the internet, before we knew there was such a thing as internet and it didn't exist, the way people organized was by reaching out to individuals one by one and building relationships and rapport so that you had a sense of connectivity and that you knew that you weren't alone in your struggle to bring about social justice. So I think that those same skill sets are the ones that we should call on. And that's why our theory of change with Alliance of Families for Justice is support, empower, and mobilize. So we are at a point here where people need to feel supported. That's essential. And so reaching out to individuals one-on-one, checking on them, just like the way things used to be, talk to your neighbor, talk to the person down the hall, obviously 6 feet away, or call somebody up and see how they're doing. And then once people feel that they're not alone, then they can entertain the idea of joining together with other people to take action, whether it's a phone campaign, a letter writing campaign, whatever the action is. Once people feel supported and they're not sinking down into a hole of depression, then they can take action together to bring about change.
Yeah, no, I think that makes a lot of sense. There've also been sort of creative things that people have done. I mean, in these reports on it, I don't know how far it's extensive, but people standing outside their windows together singing, banging pots. I don't know whether that's something in the New York environment is feasible.
I recently heard that happened in Harlem a couple nights ago. People were singing a song that was very popular by a local rapper. And I think that that's probably a good morale booster. I want to see, once we get to building morale, then moving together to take action to bring about change. We cannot remain silent in the face of this utter neglect of what's happening to people who are incarcerated.
So, what's the responsibility of the rest of us who are not living in New York but who hear your story? How do we provide that support? What way can we build that solidarity amongst us?
Well, I think the very first thing is exactly what you're doing, Feroz, which is making sure that the rest of the world hears this, telling everybody that what's going on. And your point earlier about, is this New York? Are you really talking about New York? People have this false sense that New York always has it together, and New Yorkers have this false sense that we have it all together and we know the answer to everything, but clearly we don't have the answer to this problem. So I think shouting it to the rooftops to everybody and anybody who will listen, making sure that people will listen and hear what the reality is here, and then urging people to speak out wherever they feel that they can. For those people who are internet savvy and have access to the various forms of organizing online, that's what they should do. For people who write letters, that's what they should do. People can make phone calls, they should do that. Whatever means they have available to them, that's what they should use to draw attention to this issue and say, no, not on our watch. We're not going to sit and let 2.2 million people die inside because of neglect.
Yeah, absolutely. I've just put up some information that people can find out about the Alliance for Families for Justice on the screen there, and I hope people will respond positively in that way. But it's an issue of being creative about how we organize. mean, the prison, you've talked about, you use the term the prison industrial complex.
Mhm.
Uh, that's a sort of privatized services, and they are still making a fast buck out of this. What can we be doing to challenge them, to protest against them?
So I think, first of all, I'm totally against private prisons. In New York State, we don't have private prisons, but obviously it's a real problem in other parts of the country. Um, the fact that New York doesn't have private prisons has not changed the reality of the neglect and the mistreatment of the people who are incarcerated here. So I would not say that private prisons alone are the evil, but they certainly play a role. Anytime there's an economic incentive for keeping people in cages, you're going to have problems and abuse and neglect and mistreatment. So New York is not an outlier with respect to those abuses. What we do see is privatization, and I think this was your point earlier, of various services. And that is equally problematic with privatizing prisons. So I think as a community, as a society, we need to actively reject any privatization of services that are supposedly providing rehabilitative opportunities for people. Obviously, the word rehabilitation is pretty much dropped out of the conversation most of the time. It looks good on paper, but in reality, you hear very little discussion about it.
Well, Sophia, it's amazing that there exists an organization like yours, which is really seeking to help families organize to be able to gain the courage to deal with this system of incarceration. This what was the phrase you used? This weapon of mass destruction, and it seems to me that that is going to be something really serious and increasingly something problematic, as it destroys people and families.
Girls, when someone goes to prison, their whole family does that time, serves that time with them, and they suffer a tremendous amount of pain. And they suffer that pain generally in silence. They don't generally tell anybody else, their coworkers, fellow parishioners, or neighbors, that they have someone very close to them who's incarcerated. And so what we try to do at the Alliance of Families for Justice is to take that pain that that family member is suffering and transform that pain into power so that they can do something about the systems that are causing the pain and the anguish and the mistreatment of their loved ones and ignoring their concerns in their communities.
Wow, that's a really interesting statement to make. Transforming pain into power. I think that's the fundamental message that all communities today who are faced with both the threat of the virus and the neglect of the state and its impact on all of us is to discover ways, I think, of transforming pain into power. Sophia, I really want to thank you for being on the show today. And I hope that people around the world who are watching this will take courage from what you and your organization are doing. And if there's a final message you'd like to put out to those who are watching.
Yes, I would say, it's kind of cliche-ish, but the phrase was, if they come for me in the morning, they'll come for you at night. And so if we ignore what's happening to people who are in prison and their family members, those same abuses and mistreatments are going to spread like a cancer throughout our society. And so it is incumbent upon all of us to do everything that we can to make sure that all of our fellow men, fellow women, fellow people are cared for, nurtured, and supported, and that we don't allow any system to exist that destroys them.
Sophia, thank you so much for that message. And for appearing on the show. I think you've raised some really important issues and opened up a perspective on life in New York, which even I wasn't really fully aware of. Thank you so much for being on our show today.
Thank you for having me, Feroz. Thanks for your courage.
Okay, you go well and look after yourself.
Will do. Thank you.
So that was Soffiyah Elijah from the Alliance of Families for Justice. I hope that you've benefit from this show. Please do share it with your friends and colleagues. Tomorrow I will be speaking to the author of a book called Big Farms Make Big Flu, which deals with what the source of these kind of viruses, which are increasingly spread around by the agro-industrial complex. So I hope you'll join us tomorrow, and thank you for joining us today.